Hey guys, it's Dr. J here. Hope you guys are having a phenomenal day. Today we're going to do a live video and open it up to some questions on the back end. Today's video is going to be on reducing PMS. All right, so what is PMS? PMS is that premenstruation, that maybe 7-day window, up to 7 days, maybe even longer. Some women, it's from ovulation up to when they bleed. It's that window right before they menstruate, right? Meaning before menstrual syndrome. So what are the symptoms of PMS? It could be headaches, it could be mood issues, bloating, breast tenderness, cramping, back pain, irritability, brain fog. All of these things could be happening. Typically, it's going to be primarily the falling out of progesterone a little bit early. So if progesterone falls out a little bit early, or just any abnormal hormonal fluctuation, even estrogen going up and down, that can drive migraines, which can also be another PMS symptom. So it's these hormonal perturbations or fluctuations that happen in that last week before menstruation. So what are some of the top 5 things we can do to help resolve that? So first thing is reducing inflammation. Inflammation will cause surges of cortisol, and cortisol is an anti-inflammatory hormone. And if we're constantly using our anti-inflammatory hormone, we'll potentially be pulling from progesterone. If we look at the adrenal hormone cascade, it comes from cholesterol. It goes downstream to pregnenolone. Pregnenolone goes in about 3 or 4 different directions. It can go to your mineralocorticoids to regulate minerals and blood pressure. It can go to your sex hormones, to DHEA, which can go to male or female hormones. And then it can also go to cortisol, right? And then typically the one step up from cortisol is going to be progesterone. So it'll typically go progesterone downstream to cortisol. And so the more stressed we are, the more we can allocate that progesterone going downstream to cortisol. So really important. So I mentioned first thing is reducing inflammation. That could be gluten, that could be refined sugars, it could be junky omega-6 fatty acids. Number 2 is good, healthy prostaglandins. We need good, healthy fats to make our healthy prostaglandins. Prostaglandins are like, they're eicosanoids. They're like hormone-like mediated compounds, and fats play a big role. So your omega-6, especially your junky omega-6 from refined vegetable oils, will increase your prostaglandin 2. Your prostaglandin 1 and 3 are going to be supported by healthy fish oil and healthier omega-6, such as evening primrose oil or black currant seed oil, and sometimes borage seed oil. Number 3 is just nutritional density. We need to have increased nutrition. So a lot of people, a lot of women, they're going to have more PMS, especially with low levels of magnesium. Magnesium is really important for cramping. It's really important for relaxing the musculature. So, a lot of women, they crave chocolate in that last month or that last week before they menstruate because chocolate's very high in magnesium. So magnesium will help relax the muscles. It's also very anti-inflammatory in the body and very anti-inflammatory on the brain too. We'll see high levels of quinolinic acid on organic acid tests, and magnesium really helps knock down that inflammation. So that was the nutrition density. Selenium, zinc's really important as well. Being able to digest and break down healthy cholesterol is really important. These are all nutrients that help make our hormones. Number 4 is healthy adrenal function. If we have stressed out adrenals, that means our sympathetic nervous system is activated all the time. And the more our sympathetics are activated, we're going to burn through magnesium, we're going to burn through B vitamins, and that's going to further facilitate this progesterone to cortisol episode. So we're going to continue to drive that. Now, when that happens, number 5 is we're creating an environment called estrogen dominance, where estrogen, that ratio of estrogen to progesterone, starts to increase. Now, there's still going to be more progesterone than estrogen overall, but you may start to see that 20 to 25 to 1 ratio of progesterone to estrogen start to drop maybe 10 to 1 or even less. And again, this is kind of like an average across the whole month. So it may be a little bit lower in the luteal phase or higher at certain times, but the overall monthly average is going to be about that. And it'd probably be higher in the luteal phase because progesterone pops up then. That's the last half of your cycle. All right. So in general, estrogen dominance. So now what can cause that? We can have it caused by extra estrogens in the environment coming in from plastics or pesticides, various chemicals, right? Rubbing hygienic products on there that may contain compounds like that. So number 1. Number 2, hormones in our food. Hormones in our food from our beef not being organic or pasture raised. It could also be from the water as well, runoff pesticides in the water. So get your water right, stay away from plastics, stay away from conventional raised animal products. That'd be your first best step. Now, if you get those kind of things dialed in, there's other protocols that we can do regarding using progesterone in a special way. We can use various herbs such as maca and chaste tree to help modulate LH that luteal phase and really help balance that progesterone out. We can even use estrogen modulators such as Dong Quai, black cohosh. It depends. If we have a woman that's cycling, but they're perimenopausal, we may handle a perimenopausal woman a little bit differently than a cycling female. But then I would just say, as we dive into the inflammation component, the gut can be a big source of inflammation because the gut can create inflammation, which can further this estrogen dominance. But the gut's also where a lot of those nutrients are absorbed. So if we're talking about all these nutrients to help estrogen dominance, to help detoxification, to help improve magnesium, and all these nutrients that help calm the body, calm the uterine tissue, well, it all gets absorbed through our gut. So if we have poor gut function, low stomach acid levels, we're going to have problems. All right. Hope that helps. Those are my top 5 things today. So it's going to be, of course, good diet and reducing inflammation, supporting estrogen dominance. It's going to be looking at the healthy fats. It's going to be improving digestion, and it's going to be using specific nutrients to help balance the hormones and support estrogen dominance. Those are my top 5 in general. All right. I'm going to open it up for questions, y'all. Hope you guys enjoyed that so far. What do you think? All right, a couple of questions here. So Grace's question here on teeth clenching, hard to say. Need more data on that. Teeth clenching can be caused by parasites too. It's hard to say. Need more data and just kind of keep track of it and see if we can kind of create more of a correlation. All right. Lambros writes in, why in our program regimen we started the hormones and we left aside the gut repair? We'd have to talk about that. Typically, if I leave out any gut repair stuff, it's because there's not a lot of inflammation on the lab test. Remember, you're repairing the gut by improving your diet. You're repairing the gut by just being able to digest things better. So unless there's a lot of inflammation or irritation, we don't give extra nutrients. But the nutrients we give for gut repair are going to be glutamine, aloe, slippery elm, DGL, anti-inflammatory nutrients. All right, I'm going to try to skip to only questions in regards to the female hormones today, guys. All right, we started pregnenolone to support low cortisol. We found out DHEA for the sex hormones, right? Still waiting for the, okay, got it. I'm going to try to keep the questions going here. All right. Agnes writes in, my gyne says my hormones will be fine if I'm on birth control. Any truth to that? No, I mean, birth control pills are the lazy way out, okay? So imagine you have all these fluctuations in your hormones, okay? So like kind of female hormone physiology, we have our follicular phase, which is basically days 1 through 14. And then we have our luteal phase, which is day 14 to 15 to day 27, 28. So first half is follicular, last half is luteal. So follicular, what happens is hormones drop from the previous month, right? Estrogen, progesterone drop, that causes bleeding, typically the first 1 to 7 days of the cycle. From there, as the bleeding happens, right, the hormones have dropped out, FSH starts to increase, follicle starts to grow, that follicle starts to increase estradiol. Estradiol peaks around day 10, 11, 12. Then LH is going up while this is peaking, and then progesterone is going up after. So where estrogen peaks out and progesterone rises, this is where ovulation occurs. And then we have progesterone like this from day 14 to 28, and then it comes crashing down at the end. So we could have a lot of perturbations in progesterone dropping out early. We could have fluctuations in estrogen. And so what they're essentially doing by giving you a birth control pill, they're taking your estrogen and they're just jacking it up 3 to 4 times, and they're keeping it here till day 22, 23. They're giving you some reminder pills, which are basically water pills or iron pills, and they're letting your hormones drop so you can bleed. So what they're doing is they're trying to, all this little fluctuation, they're just saying, screw that. We're going to just, it's like, the analogy would be like you're playing an instrument and maybe there's a couple of notes that you can hear that are off. So what we're going to do is we're going to get someone else to play the same instrument behind you, but jack up the volume 3 to 4 times. So then you really can't hear the mistakes when you're playing at a normal level. So they're jacking up the hormones. They're covering up the volume of your hormones artificially. They're keeping it up like this the whole time. So they're not letting it fluctuate normally. They're keeping it here, and then they're just dropping it out. And so they're covering up those perturbations, those fluctuations. And again, they're artificially driving a estrogen dominant environment because most birth control pills are going to be like an ethinyl estradiol kind of base. They're going to be a synthetic estrogen base. All right, good. Grace writes in, are you okay with me taking magnesium daily on top of a multi during PMS? Yeah, magnesium is great daily. If you have any cramping at all too in that last week, you can always do more cramp bark. That's excellent. You can even take the essential oil clary sage and you can rub it right over your ovaries or where that cramping is or on top of your uterus. That can really help relax that area. Wagon Reel writes in, get really moody when I'm on my period. What can I do to be nicer on PMS? So fix your estrogen dominance, fix your hormones, make sure your diet's dialed in, do all the top 5 things that I mentioned to start this video. That's the first step. All right, Missy writes in, I get angry when I want to snap at people. It happens a week before, and then during the cycle, I need to prevent it because I have actually told off my friends. Then next week, I apologized. Yeah, so get the hormones fixed. So you need to see a good functional medicine doctor. You got to look at the adrenals. A lot of women on their adrenals, they're going to have very low DHEA, and they could have very high or low cortisol, right? High or low cortisol is going to be a stressor. If it's low, it typically means there's been chronic stress from your adrenals, and that it's really pulled that progesterone probably downstream for a long time. If it's chronically high, well, it's going to be creating surges of blood sugar. It's going to be creating insulin problems. And it's more than likely also going to be pulling from progesterone actively at the same time. So get the adrenals looked at. And then blood sugar is important. A lot of women, they're more sensitive blood sugar wise in the last half of your cycle. So I would say probably if you're doing intermittent fasting and all, I probably wouldn't do it that last half of the cycle, especially if you have PMS. I'd really work on good protein and fat at every meal. And I'd work on, seeing a good functional medicine doc to test those hormones out and to kind of get them back on track. I mean, I'd say I have a 90% success rate with my female patients in reducing PMS significantly, 50 to 90%, some even 100. I mean, my best compliment is when I get women that say, hey, I had my period this month and it just kind of snuck up on me. There was no sign that anything was coming, and that's ideal. And now normal expectations may be, hey, I'm going to feel a little bit off a day or so before, but it's not off in a way where it's making you not function or feel yourself. You're just off a little bit, but you can still function. And that's probably a good realistic goal. All right, very good. Keep on rolling here, guys. Other than abstinence, what is the safest and best method for birth control pills? I've actually done a full video on this topic, looking at natural methods for birth control. So of course you have the rhythm method like you mentioned, but how you do the rhythm method, if you want to do it successfully, is you would chart it in an app like Flow or Kindara, and you'd measure your temperatures every day. And typically when you ovulate, you're seeing a drop in temperature by about 0.3 degrees, and then you see a spike. So it goes like this. Here it drops. That kind of signals your start of ovulation, and then it rises. So this is kind of your ovulation period with this drop and rise. So that's one way with temperature, if you're ovulating. 2, you can also look at and see, do you have any egg white type of discharge vaginally from it? That's another sign. And of course, you would just avoid intercourse at least 3 days before, 3 days afterwards. So, a good rule of thumb would be days 10 to 18, 10 to 17 at least, avoiding that. And then if you really want to confirm it, you can also just have an ovulation strip test, and you can test if you're ovulating at all in between by peeing on an OPK test. And then during that time, just use protection condoms and or diaphragm, number 1. Number 2, you can do a Paragard. Paragard is a copper IUD. Some women really have a hard time with that, but at least it's non-hormonal. It's basically preventing the egg that comes out, and it's preventing it from implanting in the uterine lining via a non-hormonal method. You have things like the Mirena, which is another type of hormonal-based IUD, and that's typically synthetic progesterone, and it's just in there all the time, creating lots of progesterone environment. Some women have a lot of side effects, but it's synthetic progesterone, so it's still not natural, and it stays up the whole time. So most women don't really get a period. They kind of just spot, like randomly throughout the month, so you don't really have a consistent cycle. I like the idea. If you're going to do something hormonally, you want to come off it for a couple of days or a week, because I think it's really healthy to keep that uterine lining flowing. So I try to be against, all hormonal methods, just because you're messing up your hormones. You're really jacking them up. Also, when you take birth control pills, there's certain nutrients that you will burn up more. You'll burn up more B vitamins, folate, B12, and magnesium. So these are really important nutritional deficiencies that you will incur when you take birth control pills. So I think the Paragard is probably your best option. And or rhythm method with some kind of barrier protection, whether it's like a diaphragm, cervical cap, and or a condom. Okay, let's see. Any other questions here so far, guys, on this topic? Why do we bleed a lot one month and bleed way less the other month? Well, estrogen dominance, a big sign of that is going to be excessive bleeding. I mean, typically you're looking at 3 to 7 days is average, and normally 4 days of flow and maybe a 2 or 3 day kind of trickle after the fact. That's kind of what you want. If you want brighter blood, that means it's fresher. If you see it kind of browner or more oxidized, it could be because you did not shed that full uterine lining the month before. And we'll use progesterone to help kind of accentuate that. And then because that nice drop, that punctuated drop in progesterone really signals bleeding and really signals that sloughing off of that full uterine lining. All right, cool. Any other questions on this topic? Let's see here. Anything else? Anything else? You guys are welcome. Glad that I'm able to help answer some questions here today. So in regards to that, I mean, there are some things you have to look out for if you have PCOS, right? That could create lots of ovarian pain. Now, if you have ovarian cysts, what's driving that? So that's a lot of times is going to be insulin resistance. And that's going to be from carbohydrates not being in check. High levels of insulin will cause elevation in testosterone, and that creates the perfect breeding ground for cysts. You may see it with acne. You may see it with abnormal hair growth. You may see it with weight gain. Some women are on the reactive hypoglycemia side where their blood sugar is constantly dropping, and they're having these reactive hypoglycemic spikes where they're going up and down, up and down. And when they peak at the top of the roller coaster, they're surging insulin. When they're dropping at the bottom, they're surging cortisol and adrenaline. So they're in this land of just always being on this roller coaster, and that will create ovarian cyst. And then you have things that can grow or occur because of estrogen dominance. You have fibroids, you have endometriosis. These can all happen. Obviously, fibrocystic breast tissue can happen as well. That harder, kind of dense, more tender breast tissue can happen too. And we typically use small amounts of iodine, especially topically on that, to really help break it up. Iodine can help optimize metabolism of estradiol into estriol. Estradiol being the stronger hormone, estrogen that's involved more in the cycling woman, where estriol is a little bit more weaker. It's typically involved more in menopausal women, but it's also very cancer protective as well. All right, excellent. All right, guys, phenomenal Q&A today. Hope you guys enjoyed it. I will be back. Actually, I don't think I'll be back next week. I'm going to be away, but I may do a video or two. We'll see. You guys have a phenomenal weekend. Put comments below. Appreciate it. Book's coming out. Make sure you signed up for the Thyroid Reset Summit. There's like an encore that's happening now. Make sure you get access to it. It supports the channel. And then get access to my thyroid book. The first 3 chapters, it's about 80 pages. And we have the cover going through editing this weekend. So we'll have this out hopefully within the next month. I'll be doing a little bit more editing on that next week. All right, guys, you have a phenomenal weekend. We'll talk soon. Take care. Bye.